Great. Thank you very much, George, and appreciate the invitation for being here today and be part of this meeting. It's my role to introduce this panel on health equity, but first a couple of observations from the advisory committee perspective. Health equity has been considered by the advisory committee very much as a cross-cutting issue, a theme that is central to improving the health and well-being of all people. It features prominently in our Healthy People 2030 framework, and as you've already heard from other speakers today, the framework has been very much a strong anchor, if you will, or a compass and a guide for all of the work that has flowed through the committee as a whole. Health equity is quite visible in both our framework and our recommendations. In addition, the advisory committee has produced several briefs. One was focused on the topic of health equity, but it shows up in quite a few of those as well. A focus on health and well-being is noted in the mission and vision statements of Healthy People 2030, where health and well-being is defined as the way people think, feel, and function at both a personal and social level, and how they evaluate their lives as a whole. The inclusion of well-being introduces a new way of thinking, moving away from what I would call deficit thinking to more of an asset-based and positive kind of approach. In addition, it allows for a connection to the more upstream social determinants of health. The emphasis on health equity then in Healthy People 2030 also marks a critical shift away from a sole focus on disease outcomes. So then how should the role of leading health indicators be considered when it comes to health equity? As a group, the leading health indicators offers a comprehensive view of high priority measures of health and well-being and early signs of risk factors that impact morbidity, mortality, and well-being. Leading health indicators, as we've noted in our report, serve as a sentry standing watch over the health and well-being of the nation. As such, LHIs are positioned to be a short subset of Healthy People 2030 objectives that ideally provide an overall impression that is representative of health and well-being of the nation. However, the LHIs can only do this if the objectives as a whole are representative of the vision and the framework as we have presented in our report. Unfortunately, in our Objectives Review Subcommittee report, several concepts that are emphasized in the Healthy People 2030 framework were not adequately addressed within the draft set as we have seen them up to this point. Among the concepts that need to be addressed more fully is health equity, health promotion, health literacy, upstream and structural determinants of health and well-being, as well as vulnerable populations, for example, area pertaining to disparity and equity. The fact that this initial draft set of objectives may not adequately represent the proposed framework is not surprising, given the shift towards inclusion and well-being, the need to reduce by more than half of the existing more than 1,200 objectives, and the introduction of core versus developmental and research objectives. However, as a result, there is a need to think more broadly about the approach to select leading health indicators. Perhaps restricting LHIs to a subset of the core objectives alone does not allow LHIs to meet the idea that they will be representative of the health and well-being of the nation and as such represent the Healthy People 2030 framework. Given this context, it seems reasonable to propose a few areas of emphasis related to health equity and the goal of development of a set of LHIs for Healthy People 2030. First of all, the LHIs should be representative of the Healthy People 2030 framework. Secondly, LHIs should be inclusive of a set of clearly marked health equity measures that address the needs of vulnerable populations. Number three, LHIs should be proposed that balance the existing objectives related to disease prevalence and proposed that balance the existing objectives related to disease prevalence with disease incidence measures that reflect the focus on disease prevention. Incidence measures across subset of populations will address considerations of health equity and determinants of health and well-being. Number four, LHI should consider measures that provide the basis for meaningful comparisons against other countries. Whereas no country has achieved health equity as previously defined within the Healthy People program, others have come closer to this ideal than the United States. Comparisons of specific LHIs may allow us to learn and improve. And finally, The criteria to define LHIs may need to be adjusted to allow LHIs to be reflective of the framework of Healthy People 2030. That is, it may be necessary for LHIs to include measures that go beyond the final set of core objectives and may be considered summary measures of health and well-being reflective of the nation's health. With that, I'd like to introduce today's panel members. We have one panelist who cannot make it, Stephen Wolf, but Brian is going to talk about his comments. Brian Smedley is co-founder and executive director of the National Collaborative for Health Equity, and he'll do the first presentation. Then we have Sarah Treuhaft, Policy Link. Sarah is the managing director of Policy Link, and she's joining us remotely. And as I said, Stephen Wolf from Virginia Commonwealth University will not be here today, but Brian will take his comments. Brian?